NHA Phlebotomy Exam 2025 40 Real Questions Answers Updated. Question 1. Hemolysis can be caused by using a 21G needle, shaking the tube vigorously, drawing from the median cubital, inverting the tube 5 times. Vigorous shaking destroys RBCs. Question 2. Needle insertion angle for venipuncture, 45-90 degrees, 15-30 degrees, 5-10 degrees, 0 degrees. 15-30 degree angle is standard. Question 3. What happens if a tourniquet is left on for 1 minute? Hema concentration, hemolysis, hematoma, petechini. Prolonged stasis leads to hemoconcentration. Question 4. The most common vein for venipuncture is cephalic, basilic, median cubital, radial. Median cubital is first choice. Question 5. What is the purpose of the additive in a tube? Change color, prevent or promote clotting, increase volume, keep blood cold. Additives serve specific chemical functions. Question 6. What is the correct order of draw for these tubes? SSD, lavender, blue, blue, SSD, lavender, lavender, blue, SSD, green, blue, SSD. Light blue citrate, SSD serum, lavender ETA. Question 7. Syncope means heart attack, fainting, vomiting, bleeding. Medical term for fainting. Question 8. Appropriate site for infant heel stick, center of heel, medial or lateral plantar surface, the big toe, arch of foot. Safe zones to avoid bone injury. Question 9. Which tube contains heparin, lavender, green, light blue, gray? Green top tubes contain heparin. Question 10. Blood cultures are drawn first, last, after SSD, after lavender. Drawn first to maintain sterility. Question 11. Which tube is used for coagulation tests PT/PTT? Lavender, light blue, red, green. Light blue sodium citrate. Question 12. A patient should be in what position for blood draw? Prone, standing, seated or supine? Trendelenburg. Seated or lying down for safety. Question 13. What should be done first if a patient faints? Finish the draw, call a code, remove needle and tourniquet, give them water. Safety first, stop the procedure immediately. Question 14. Maximum depth for heel puncture, 1.0 mm, 2.0 mm, 3.0 mm, 5.0 mm. 2.0 mm to avoid calcaneus. Question 15. What is the antiseptic of choice for routine venipuncture? 70% isopropyl alcohol, povidone, soap and water, hydrogen peroxide. 70% IPA is standard. Question 16. Which tube is used for a CBC? Green, red, lavender, light blue. Lavender ETA is for hematology/CBC. Question 17. The bevel of the needle should face down, sideways, up, any direction. bevel up for easier entry. Question 18. Wiping away the first drop of blood is standard for venipuncture, capillary puncture, arterial draw, blood culture. Removes tissue fluid and alcohol. Question 19. Post-draw, how long should pressure be applied? 10 seconds until bleeding stops. 30 minutes. Until hemostasis is achieved. Question 20. Glycolysis is prevented by which additive? ETA, sodium citrate, sodium fluoride, SSD. Sodium fluoride gray top preserves glucose.